Sometimes treating what ails you only covers up your symptoms, but as Carle Cardiology Specialist Karen Wiarda shares, through steady lifestyle changes, it is possible to address the root cause of what's bothering you. We'll dial into lifestyle medicine in this episode of Being Well.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking about really taking your lifestyle back through health. And we've got a returning guest to the show. We've got Dr. Karen Wiarda. Welcome back.
Thank you.
And you are coming to us from Carle?
Yes.
All right. So if we've got viewers who are newer to the show and maybe didn't catch you last time, can you give us a little bit of background of what you study, how you ended up at Carle?
Okay. I'm a non-invasive cardiologist, and I have a specific interest in obesity medicine and lifestyle medicine, and I've been working at Carle now for 6 years. And I actually came to Carle for outpatient non-invasive cardiology, so I enjoy the outpatient aspect of cardiology and have just really enjoyed the growth of the practice. We offer a lot of modalities right in the office, including cardiac rehab, and so I'm able to sort of add lifestyle medicine and prevention into my practice quite naturally with what we offer right in the office. So I've really enjoyed the experience.
Well, wonderful. So today we're talking about lifestyle medicine, and I can't say it's something that I had actually heard of prior to it being suggested as a topic. So if you could give us a little background generically, what is lifestyle medicine?
So lifestyle medicine is sort of going back to the root of the problem and focusing on reversing the chronic diseases that we have. So instead of focusing on illness, lifestyle medicine focuses on wellness. Instead of adding medications, a focus for lifestyle medicine is to reduce medications. So instead of treating a problem like diabetes, we're trying to reverse a problem like diabetes or heart disease. And the focus of lifestyle medicine is a focus of the 6 pillars of health, which is basically making sure that we have a healthy diet, which in this case is a whole food plant-based diet, which is minimally processed plants. So it is fruits and vegetables and whole grains and nuts and seeds and legumes. So the real focus, when it comes right down to it, is fiber. Only 2 to 3% of this country gets enough potassium naturally, which is found in fruits and vegetables. And so we're trying to replace things like potassium. We're trying to replace all of these with medications, but really when you get natural potassium, that's a natural way to reduce your blood pressure, which again is eating more fruits and vegetables. And 3 to 4% of people in this country get enough fiber, which at a minimum, very minimum, is 25 grams a day for women and 30 grams a day for men. My minimum is about 40 grams a day that I want patients to achieve, and really, in terms of fiber, the sky's the limit. And again, it is about eating plants to get fiber. So there's no fiber when we eat meat. There's less fiber when we eat processed food. So the focus is to have completely unprocessed food to the best of our ability. And every time you process something more, you take fiber out of the picture. So even, which is so interesting to me, I was doing a discussion about fiber, and I was kind of going through my cabinet to talk about like just the fiber products, and my focus on fiber often is beans, legumes, kidney beans, black beans. I mean, any legumes you can eat. Lentils are my personal favorite, but they're very high in fiber. And when I was looking at even just the can versus the box, just even canning the beans is half the fiber. So you get the most fiber when you're cooking it yourself, when you're preparing it at home. And that's sort of the point of an unprocessed diet. So even when you look at oatmeal, steel cut is the least processed, so it's the most healthy, it has the most fiber. The more your body has to work, the more fiber and the more improvement in what's called your gut microbiome. So our gut microbiome, we're made up of trillions of cells. And so we're literally half human, half microbes. And so if we have a healthy gut microbiome, again, eating fiber and unprocessed foods, then we are actually have significant improvement in our health. So there's a direct link with not only, health and immunity, but even with depression and even serotonin. So when we think about depression and serotonin is sort of this, I'm happy, I'm content. And the problem with our sort of current lifestyle is we're too focused on dopamine, which is I want, I need. And so the focus of all health is to sort of stop the addictive process of dopamine, essentially coming from dope, and that's the brain center that says I need. And actually, even with dopamine, the majority of dopamine comes in wanting something and thinking about wanting something than actually having it. So for instance, sugar. We want sugar, but thinking about wanting sugar actually lights up the dopamine more. And when we eat the sugar, that's about 10% versus 90% of the wanting, which is just amazing. But what's even more amazing is they did a study and they said, okay, so if we're having too much dopamine, what happens if we just cut dopamine out? And this was in a rat study, and all the rats died because they didn't even get the joy of either thinking or eating. And so you need dopamine, but you need to process dopamine appropriately. And so when we're eating sugar and fat and salt and oil and all these things that are processed, our body is so focused on getting that dopamine hit, just like drugs, that it's very difficult to change that behavior and get to a non-dopamine diet, which is basically a serotonin diet with appropriate dopamine, and that's more fiber and plants. And so that's the focus really of having plants. But even with serotonin, so when patients are on medications for depression, they're on something like a serotonin reuptake inhibitor so that we can keep the serotonin in our system. The gut microbiome is actually responsible for 90% of our serotonin. So there is a direct link, even with depression, with having more serotonin. So the diet and what we eat and how we live our life is incredibly impactful. So when we look at lifestyle medicine, not only do we look at diet, we look at exercise, we look at good sleep habits, we look at community, because there's significantly improved depression and success with positive behaviors, even just looking at when you're around people and just being around people who do those positive behaviors. And then we're also looking at, obviously, reducing substance abuse like smoking, and then dealing with stress management, which is huge.
We covered a lot there. So just under nutrition, just to make sure we've got the cliff notes, try to eat less processed,
Yes.
more fiber.
Yes.
And you were saying legumes
Yes.
are beans
A
are the
great
way to
source
go.
of fiber.
And you had thrown out a number as far as grams per day. What does that look like in a diet? Is that like a bowl of oatmeal, a side of beans, a whole bowl of beans?
So really it's about eating all these things throughout the day. But if you were to say have oatmeal, the most unprocessed oatmeal, so the longer you have to cook it, the better it is. I tend to make overnight oats, which sort of does the work of cooking overnight with plant milk. I use plant milk. But if you had that and chia seeds, so 2 tablespoons of chia seeds is 10 grams of fiber.
Okay.
And then the oatmeal itself is 5 to 10 grams of fiber. And then you add berries on that, and then any kind of fruits, and you even have fiber in nuts, but mostly if you do fruits and adding chia seeds, flax seeds, you're actually right there going to get 10 to 20 grams of fiber right there.
Wonderful.
And what's interesting and sad at the same time is coffee is often the highest amount of fiber a lot of people get, because there's actually coffee is a plant. And so there's actually a fair amount of fiber in coffee.
Look at me getting healthy.
Yeah. And
This
so,
coffee.
but there's, coffee actually has a lot of benefits cardiovascularly. It actually reduces the risk of heart attacks and strokes.
Oh, I know. I can feel it.
Yes, exactly. Most people can
Sorry.
feel it, aside from just energy, benefits of energy.
Yeah.
And so there isn't a problem with coffee. The problem with coffee is what people put in it, right?
Yeah.
And so, but there's actually fiber in coffee. The other thing is a cup of beans can be up to 10 to 15 grams of fiber. Just a cup of lentils or a cup of kidney beans or a cup of black beans, 12 to 15 probably is more accurate. And if you even, so there's a cup of fruit, a cup of vegetables is typically a serving.
Yeah.
That can have up to 5 grams of fiber depending on what you're eating. So if you add even just an apple to your food every day, or they always say pre-eat with like an apple or some sort of fruit, so that you're already starting the process of digestion in a healthy way, and you're making your body work for that fiber right from the beginning, and it adds to satiation. So even starting with an apple or starting with a carrot before you eat your meal can be beneficial. But the focus is greens. Eat your greens, eat your spinach, eat your kale, eat your, and I do a fruit smoothie in the morning, and it is better to eat your fiber than to process your fiber. I will make that comment right away. It is definitely better to at least have a smoothie over a juice. So a juice is just sugar. But we have literally a bunch of fruit. We add greens and kale, and that is what we drink. And that is actually right there is probably a good 10 to 15 grams of fiber. Just depends on how much you put in and how much you eat. But you can get incredible fiber just from that.
Well, wonderful. Okay, so we've covered nutrition.
Okay.
Moving on to sleep. I don't think it's rocket science that we're not getting enough sleep or
agree.
enough quality sleep.
Yes.
So what is recommended for this wellness journey?
So actually the recommendation from the American Sleep Society is 7 to 9 hours of sleep a night. And it is variable from person to person, but anyone who really is getting less than 7 hours of sleep is actually at a 16% increased risk of morbidity and mortality. So it is incredibly impactful. And when we look at sleep, not only are we looking at a true sleep problem like obstructive sleep apnea, which people need to be screened for and need to be treated. And so there's a look at that is just looking at a stopping score. I actually tend to just ask, when you wake up, do you feel rested? Do you snore? Are you tired all the time? Do you nap? People who are in the obese range have increased risk. People who have small airways have increased risk. And so sleep apnea is actually a medical problem that requires a CPAP or even potentially a BiPAP. So that is something that needs to be formally diagnosed in a sleep lab, and the treatment for that is CPAP. But there is a reversal potential for sleep apnea with weight loss. But sleep can also be impacted by stress. And so if someone isn't sleeping well because they have so much stress in their lives, or they have the phone here, they have the music here, they have the TV on, and they're getting all of that bad light that's actually keeping them up. Simple things like just making your bed your sleep. Moving the phone, moving everything away so that you're not focused on it and potentially out of the room. But sleep is incredibly impactful.
And then moving on to physical activity. If you're doing enough physical activity, sometimes that'll help you sleep better as well.
That's exactly right. And not only that, but I think people think that exercise has to be a chore, right? So the recommended guidelines are 75 to 150 minutes of moderate intensity exercise. And that means...
Is that a week?
That is a week.
Okay.
Yes. And that is, moderate intensity is basically where you can walk and talk at the same time. So that could be walking even at a rapid pace. That can be, but you should be able to talk. High intensity, and that's about 75 minutes a week of high intensity. That can be, you should be able to talk but not sing. So that means you're working out hard enough that you're able to get that exercise and you're getting your heart rate up enough. But people need, when they think of exercise, do what you love. I mean, even gardening is great exercise. Yoga is great exercise. People who love to play golf, that's great exercise. And that's community, and that's, and so that's social, and it's exercise, and it actually reduces stress if you don't take it too seriously, I guess. yes. But when we think of exercise, think of fun, you know, and that's
It's
why
not a run. It's not I have to go to the gym.
No, it is
move
not.
Your body.
It's just move your body. And studies have shown repeatedly that if you move more hours of the day versus exercising for one, you're actually better off. And you do not have to exercise for an hour at the same time every day. You can do snippets of 10 minutes, snippets of 5 minutes, literally, and get that time in. In some ways, you're actually potentially healthier. The other thing is incorporate exercise outside and get your vitamin D, right? So the only way you can truly get vitamin D is by the sun. So go outside and go in the sun and take a walk and go with a partner and make it fun. And if that's fun to you, then that is meaningful exercise. So the best exercise is the exercise you're going to do. Yeah.
That's right. You don't want to bite off more than you can chew.
That's exactly right.
And then you don't do any of it. You
That's
just,
exactly
kind of
right.
feel defeated if you set those goals way too high.
That's exactly right. And I think the other thing is that I always, there was a professor in med school that said, look at movement as an opportunity for movement. And that is basically, I joke around with my husband about it all the time, but I love the Fitbit simply because it makes you accountable. 10,000 steps. There was no real research for 10,000 steps. It's about 4 miles a day, but it gets you moving, and that is a good 4 miles a day of walking, which is fantastic, right? So it depends on your steps versus someone else's steps. I used to beat my son because my steps were shorter, so he could, I could walk him and I could beat him, but you're still exercising repeatedly, and you're just moving, and just look for opportunities of movement. Helps depression, it helps weight loss, it helps even reducing smoking. And even an hour of walking a day reduces your risk by 25%. I mean, it is incredibly impactful.
I'm so sorry, 25% of what?
Reduces your risk by 25% a day. Just walking an hour a day reduces your risk by 25%. I mean, it is incredibly impactful.
Wonderful.
Yeah, and that's for any age. So the point is if you walk, you keep walking, right? So it reduces the risk of falls as you age. If you, and then if you add mobility to it and weights, the recommendation is at least upper and lower weights, each body part once a week. So twice a week, adding weights to that, because then you're adding muscle, and then you reduce wasting and things like that.
Excellent.
Muscle wasting.
So we've covered exercise. Now moving on to substance abuse.
Yes.
Which can be oftentimes maybe used to cover up a lot of these other things we're not addressing.
That's exactly right.
Can you talk about that?
In substance abuse, I mean, I know that we all classically, of course, talk about smoking. And, stopping smoking within 5 years, or you're at the same risk as being a non-smoker. And so every time, it's always better, just like with weight loss, it's better to keep trying and quit and go back, but at least you keep trying, right? I mean, the goal is to quit. And so if you don't even try to quit, you're not even halfway there, right? And so even thinking about quitting, but even just reducing by 1 cigarette a day, and then more by 1 cigarette a day, and then more by 1 cigarette a day, that risk is the greatest risk for heart disease specifically. It is diet for sure, but it is smoking. And smoking, what's interesting about diet is even when you look at WHO carcinogens, processed meat is a class 1 carcinogen on par with smoking. And red meat is a class 2 carcinogen. So these processed meats, deli meat, bacon, any of those processed meats, sausage, all of those things are actually a class 1 carcinogen. So it is about making all of these changes, but smoking is right up there. And so alcohol, if it's abusive, is obviously an issue. Yes.
Moderation for alcohol and for the foods that are maybe more processed and delicious, but they're not necessarily good for us.
Right.
All right, moving on to stress management. This is such a big one. Every career, anytime I interviewed somebody as a reporter, it didn't matter where I went, they were always carrying excess stress. So what can we do to manage stress in our lives?
And I think, it's interesting because when we look at stress, not only is it external stress, but actually when you look at stress, even just bad habits increase stress in the body, right? And so again, that then changes the hormones in your body, and then you start having increased stress hormones. So acute stress reaction is normal, and that's actually a healthy reaction because that's what makes us run away from the bear, right? But when we have chronic stress that's long term, then we start having actual impact on our health. And so it changes our hormones. That stress hormone is elevated and elevated. That actually increases obesity, it increases blood pressure, it increases heart disease, it increases AFib, it increases structural changes. And so stress can be incredibly impactful. And so the goal in stress, you know, it's interesting. I think one thing is people need to be aware of their stress, right? Most people are, but sometimes we're not always aware of just how stressed
This is just how I am.
It's exactly right. This is normal. And so even some of these healthy changes and even a healthy diet actually reduces your stress. But some people need to go on medications to address their stress. And so whatever is going to be impactful for you to reduce your stress, it's incredibly important. But if you're someone who has issues, you need to look for the support. So someone who, you know, we refer to social work a lot because there's financial stressors. There's, you know, stressors with transportation. But there's a lot of support services out there to help you. And so we want to reduce every aspect of stress. And so sometimes that's seeing a therapist. Sometimes that's actually even just, you know, basically talking it out and having that buddy to actually support that stress through. Sometimes it's going on medication short term so that you can actually deal with some of the stress and respond to it differently and actually get back in control. So stress is actually reduced by exercise. Yoga can be incredibly impactful for stress. And of course, things like mindfulness exercises, meditation can be very, very helpful for stress. And, you know, even for sleep, meditation is actually very helpful for sleep as well. So meditation is a nice way to reduce stress. But there's even a stress-induced heart attack, or what's called a Takotsubo cardiomyopathy, where these stress hormones are so high that they actually can get a heart attack from it. So they typically get this sort of ballooning of their left ventricle, and it reduces their heart function, and it is literally from increased stress. And so that is an acute event. It feels like an acute heart attack. You are actually treated with medications that are very similar, especially beta blockers, to reduce the stress hormone, or ACE inhibitors, which reduce the salt and the stress hormone, salt hormones. And that process can be reversed, but it can also recur with increased stress. So stress needs to be addressed. And I think the point of stress is talk to your provider about it, talk to your family about it, and come up with a plan to reduce stress.
And you mentioned talking to your family, which leads into our last pillar of this lifestyle medicine, which is your social connections.
Yes. And people, it's interesting because even with social connections, right? So the people who you associate yourself makes total sense, but you have to really think about it. If you associate with smokers, guess what you're probably going to do is smoke. If your group has gained weight, you're probably going to gain weight. If you associate with people who eat a whole food plant-based diet, you're probably going to go on a whole food plant-based diet and increase your plants. Trust me, we're out there. But there's actually a lot of community for that. But the thing is if you associate with positive behaviors, even in your social circle, that's going to help. I mean, so many patients say, my family won't eat this way. And I'm lucky because I have lost quite a bit of weight doing this. It has helped me. I believe in it. I love plants, and I feel so much better eating plants. But my husband does the cooking and he completely supports me. And so even the kids do, you know, I say vegan isn't necessarily, it's closer to this conversation, but it's actually even sort of more sort of less processed than even vegan can be. But the point is they support me. And so if you're with people who support you, then that makes such a difference. And so you want to be part of the community that supports you with stress, that supports you with exercise, and you want to change your habits. If your habit is to get up and not exercise, make the habit to get up and exercise. I kept not going to bike class. I love spin class, and I kept not going because I said I can't make it for the whole 45 minutes. And then I said, what am I doing? So I go to spin class 5:30 in the morning at the YMCA for 30 minutes. I don't, and that's what I can do and still get to work on time. It is our habit. If I can go back for the afternoon class, fantastic. Otherwise, I can go walk or do whatever I can do at the end of the day. But it is my habit to go with my husband Monday, Wednesday, Friday to the spin class. Tuesday, Thursdays, our habit is to get up and run at 5:30. So it's our habit. And if you don't do it, you feel different, right? You're like, I'm missing it. I'm missing the habit. So when you go to light up, think to yourself, do I need this cigarette or is this a habit? Change the habit. And one small, tiny change can be so effective. All I said was, I'm going to go to this class for 30 minutes instead of 45. And now every Monday, Wednesday, and Friday, unless I'm out of town, we're going to that spin class. So, and change the habit. Change one tiny little habit, and that turns into bigger habits. Change the habit of, I'm going to eat, if you're eating one fruit or vegetable a day, I'm going to eat 2 fruits or vegetables a day. And just go from there and change one tiny little habit that turns into big habit changes, and it's incredibly effective.
And it's important to remember that what may work for you might not work for me, but to
100%.
just find your own way.
That's exactly
and
right.
as we're under a minute, but just to
Yes.
sum up, is it better to attack all 6 of these pillars at once, or find one and work your way out?
So my personal opinion is, look at the one you want to change the most and make, like I said, one small habit at a change. It isn't about, sure, some people, they can go and they can change everything at once. That's rare.
Good for them.
That is rare. It wasn't the way it worked for me, but I've always been an exerciser. I've always loved plants. So for me, the habit was easy because it was just being stricter, and it was saying, okay, I'm going to eat less processed food. But you have to do it because you enjoy it and it works for you. And then eventually it works for you and you love it because you feel better. So my issue is always change one small thing at a time and work on habits slowly, and they tend to be more effective.
Dr. Karen Wiarda talking about lifestyle medicine. Thanks for being on the show today.
Thank you. It was wonderful being here.
Awesome, and we are so happy you joined us today, and we hope you'll join us for our next episode of Being Well.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.